The anatomic terms we're going to need to know whenever we're talking about the human body, especially today with the elbow. We want to know something called anatomic position. So our patient today is going to stand in anatomic position. It's hands supinated. Pronated would be backwards. So in this position we can name everything in the human body, and we do. So the front side is called anterior. The back side is called posterior. So anterior means towards the front. Posterior means towards the back, according to this position. Everything is identified in anatomic position. The next couple terms we need are medial and lateral. But what you have to understand is the mid-sagittal line. If you were to take an axe or a chainsaw and cut Harut right down the middle, all the way down, we're going to split him into left, right sides. That cut right down the center of the body is called mid-sagittal line. And it will tell you everything as far as directional terms go. So from that mid-sagittal line, if we go closer to it, so say this part of his shoulder is medial when we compare it to the thumb. It's closer to the mid-sagittal line, therefore it's medial. Anything closer to the line means medial, so back and forth. Now, say you want to go away from the sagittal line, so the furthest point away from the mid-sagittal line is lateral, is your thumb. So technically your pinky is more medial than your thumb because it's closer to the midline. The thumb is more lateral than the pinky because it's further away. So you always go according to that midline. Two terms, or a set of terms that are very similar. Now we have, if you're trying to identify something above, we say superior or closer to the head. If we're trying to say below, we go inferior or away from the head. So in Harut's case, we would say his shoulder is superior to his waist. Or we could say the waist is inferior or below, further from the head, compared to the shoulder. Now, very similar, we have two other terms, proximal, distal. We use those when we're talking about the appendages, the arms and the legs primarily. It's closer to the point of attachment. So proximal means closer to the origin or where it attaches. Distal means further away. So the elbow is proximal to the shoulder compared to the wrist. Or you could say the furthest point, which is distal, distal tip of the middle finger is distal compared to the wrist when you're looking at the shoulder. Two other things when you're talking injuries, superficial and deep, exactly what it sounds like. A superficial injury means closer to the surface than anywhere on the body. Deep just means deeper towards the core. That's the terminology.